To this morning's huddle, brought to you by Going on Offense. My name is Darrell Moon, and I'll be your host today. Thank you for being with us, and we hope you will join the conversation. We have a wonderful guest panelist today to talk about blending yoga and physical therapy. We're holding these huddles every Monday, Wednesday, and Friday in an effort to be supportive to those who are struggling, particularly emotionally, with all that's going on, to brainstorm strategies to help, to promote resources and engage collaboration. Now to introduce today's guest. It's my pleasure to introduce to you my friend, Dr. Melissa Kerr, an integrative physical therapist and owner of Be Well Therapies. I'm going to invite Dr. Kerr to take about 4 or 5 minutes to introduce herself and share a comment or two about today's topic. But before I do, I want to invite all of you to participate in today's conversation. We would love to include you. Please feel free to raise your hand on the control panel and we'll turn on your microphone. You can join the conversation, ask questions, make comments, or if you'd like to just send in a question or comment through the control panel, you're welcome to do that as well. Dr. Kerr, would you like to introduce yourself?
Hello. My name is Dr. Melissa Kerr. I have been practicing in physical therapy longer than I want to admit. I'm closing in on 25 years. And somehow, you pick things up along the way through your career, and you might start off in one trajectory and then you change course of path a little bit. Somewhere along the way, after being with a large health system for about 18 years, maybe a little less than that, maybe 14, 18, somewhere around there, my path changed without my choice of that. Sign of the times, my job shifted in a way that I hadn't planned. And I decided I was going to greet that challenge. I ended up going back to school to pursue my doctorate. And it was at that time that I started, my doctorate work actually focused on the evidence-based findings of yoga in relation to healthcare, specifically in physical therapy. I'd been practicing yoga for quite some time, and I'd been dabbling in martial arts. And I was doing some Qigong and Tai Chi training, the internal healing arts. And somewhere through this magical time frame, everything started to fall into place. I shifted how I wanted to practice. I shifted how I wanted to pull things that I was passionate about in my personal life more into my professional life. And it was right around that time that I met Dr. Michelle Thompson on a yoga mat. And lo and behold, if we didn't start to collaborate and work together, and we ended up developing Be Well Therapies, which Dr. Thompson is a primary care practitioner, and she is board certified in integrative health, and she is board certified in lifestyle medicine. I should say integrative medicine and lifestyle medicine. So she's like a triple threat. Everything about our beings are just connected on a level that is phenomenal. So to be able to have a friendship that develops and then realize personally, and then have a professional connection in a way that I don't want to say we're the oddballs or the outsiders, but we certainly don't stay in the middle of the beaten path. We tend to veer off to the edges, if not way at times go outside the lines. But it all comes back to, let's look at the best evidence we have with what we would like to do, and then balance it between the art and the science of what we both do, using and filling our toolbox with as many tools as we can. And all of that combining over the last few years has evolved into having our website, finding our tribe with our friends in sound therapy, with our colleagues in mind-body medicine, work we're doing with nutritional stuff and culinary medicine. And yeah, we've just kind of moved along this path, and here we are.
Well, I must say you have one of the most interesting and I think great examples of where healthcare really needs to go. And you talk about not being in the beaten path, but you're just ahead of the path. I mean, you're where we need to be. And talk a little bit about how, because you're so well positioned, this current situation that's full of health risks, economic challenges, fear, pandemic, emotional challenges, Talk a little bit about how you've been able to respond with all of your integrated resources in helping people, because I know you've been extremely busy over the last few months
Yeah.
during this pandemic. Things have just been crazy. So talk a little bit about how you've been able to really respond to this situation with your integrative team.
In hindsight, it's like, wow, did you plan this? And not really.
Mhm.
So along the way, um, to give just a better idea, I have my day job. I'm roughly working in an insurance-based clinic, maybe 30 hours a week. Dr. Thompson is working for UPMC Health System. And then in our I don't ever want to call it spare time, but in the time we set aside to do this Be Well project, we tend to blend and utilize the best of all of our resources. So Dr. Thompson's had this free community gathering, so to speak, like maybe once a month or once every 2 months, there's a free event. And this is pre-COVID, right? So we would show up on, usually it was a UPMC facility, and there would be an event. Maybe 1 month, the topic is on sound therapy and how that's beneficial. 1 month, it's on a nutritional topic. 1 month, it might be on yoga or meditation. So the community members that are familiar with that know that there was always a free event where you could get exposed, because we don't ever want there to be a barrier. Sometimes finances are a huge barrier to, I can't afford this, so that was kind of our base. We reached out and had this nice community awareness. We had been planning with Be Well to switch things to going online and having a digital footprint, where we were doing some teaching kitchens. We started booking some events online, and then boom, this pandemic comes along, and where we wanted to be ready for telehealth maybe by the start of May of this year, we had to suddenly, boom, kick that up to March. And our planned teaching kitchens had to, boom, suddenly start in March. And so our community events became these social hours that we started in March on how are we going to cope with, the stress of a pandemic, or what do we do for exercise during a pandemic. So we took the blueprint of what we would do in the community, we moved it online, we started using Zoom, and trying to make some of the classes I teach, trying to make them affordable, but $5 for the yoga classes or the Tai Chi classes, and
Mhm.
being able to reach out to people so that maybe they'll have that opportunity to hear us on a free event or participate in maybe one of the class events. That how we breathe matters. It matters to our mental health. How we eat, oh my, matters so much. What you choose and what you don't choose makes a huge difference. Mind, mood, and food, it's so interconnected. Knowing that we still need to move, we cannot afford to stay sedentary. Knowing that we need a place to still connect, because socialization is just absolutely imperative to our longevity. The studies that show, we need that connection. And when you're being
Yeah,
told, distance yourself, that doesn't mean isolate. So we
yeah.
we have to work on our resilience, and sometimes that's more change than we're comfortable with, particularly in such a short period of time. So we've just shifted everything to trying to encourage people to embrace the digital aspect. Now, there are still people that have the barrier where, technology is just, um, it invokes more fear. So they might need a little more of a hand holding, if you will, digitally to, what can we do with a phone? Um, so yeah, it's been a fast paced, you know, pick it up and roll with it transition, but we're all dealing with it. So we just have to laugh at some level at, the challenges with how do I navigate, my sound on my device, and everybody has a
Right,
different device.
right,
And
right.
so we try and bond through that, and support each other.
And have you found it to be fairly successful in being able to do a lot of things remotely? Has that worked for a lot of people?
Yeah, so I think the biggest barrier is just reassuring people that trust us, it's going to be
Yeah.
okay. Once we get past the fear of, for some people, it's, I don't even know how to work my email, let alone, what do you mean I have to download an app to log in? But once we get the opportunity to kind of break the ice there and work through that, it is amazing to see how people are like, oh, at least I can, I don't have to let people see me, but I can listen, and I don't have to turn my microphone on, but I can still participate.
Right.
Um, I think that's freeing, and
Mhm.
for me, really getting thrown into doing, say, if I'm doing a PT assessment online, it's there's two sides to it. One is great. I have people that can try to shift and turn their devices and make sure they're trying to figure out where their camera is so I can, can I see your knee? That's sometimes hard to
Uh,
do when your camera's in reverse. And
mhm.
some people cannot manipulate that, whether it's because they don't have the dexterity in their hands, or they're just so overwhelmed, they just need to hear a voice. It's really helped me hone in on, I think the single most important thing is the communication verbally. Tell me your story. Tell me why this is an issue. And then once you tell me why it's an issue, I'm probably going to need to know a little more, like, you know, delving a little bit more into that psycho-emotional aspect in terms
Mhm.
of, what emotions are you afraid? Is there fear? Is there a history? And with history, then we might get into like adverse childhood experiences, and those don't always have to be the most traumatic things, but how we learn to deal with pain, or how we learn to deal with food as we grow up. It shapes us, and then we find ourselves getting into a situation. I might not ever need to really see your knee joint to know how it's bending or straightening, to
Mhm.
help start to break down some of the bigger barriers. So I've honed those skills in a little bit better.
Nice. So today's topic is how you've been successful at blending yoga and physical therapy. Take a
Mhm.
few minutes and talk about how you brought those two together to be a wonderful resource for patients.
Yeah, so it's interesting. And I still find today I have to be really aware of using the term yoga with probably the majority of the people that I work with or am around, because yoga tends to trigger a preconception, right? Some
Right.
people think yoga means being very athletic or standing on your
Mhm.
head, or
Mhm.
yoga means chanting and oming, and
Mhm.
sometimes those things automatically trigger the defense, and we get, I'm not flexible, I'm not in shape for this, or this might conflict with my religious views, or I'm not in line with what I think that might mean spiritually.
Mhm.
So I feel I need to take that Eastern concept that has this Western stereotype and try and move back to anatomically, physiologically. Let's just work on breathing for starters. And, people are like, why do I want to breathe? I'm talking to you about a knee issue or something else going on, right? And it's like, well, let's take a look at, are you stressed? Are you anxious? And in the pandemic, the answer to that is probably yes
Yes.
times 1,000 for both of those.
Yep.
So breathing is part of yoga, moving is part of yoga, meditating is part of yoga, learning to enhance your relaxation response is part of yoga. So we'll take breathing as a part of yoga. And the benefits to working on that is, if we can learn to tap into how we take a diaphragmatic breath. When our diaphragm moves, we floss our vagus nerve. When our vagus nerve is flossed, we're automatically flipping a light switch on to the rest and relaxation part of our brain. So we tend to get stuck in this sympathetic overdrive, or this I'm stressed all the time. And for some of us, there's a trauma, a big event that flicks that light switch on like bam all at once, and then we get stuck there. And
Mhm.
for others of us, it's real little things that build up, and we don't really deal with it because it's not that bad. We'll worry about it later, but it just starts to pile up. And then we get so much build up in the stress response that the body kind of is like, I think you're crying wolf. I'm not sure if you really need me or not. So I'm just not going to even respond to this. And then our light switch gets stuck in that on stress position. And I could talk for hours about the physiology of that and the consequences, but then we get our hormone levels all goofed up. Cortisol either gets dumped in too large of an amount, or eventually we make none of it. So we're in extremes again. And that's going to affect your blood sugar levels and your fat stores and your mood. And but guess what? If we start breathing in a way that we can access, that starts to move and manipulate the diaphragm, we're starting to turn that light switch off. And we might breathe for 5 minutes and then we stop and bam, it's like, here we are right back in the stress state again. That's okay. It's 5 minutes that I'll take. It's 5 minutes where my physiological response got to be altered. And then the more frequently we access that, the more frequently we start to manipulate the light switches. So that's just the breath part. But if we can take the breath part and then maybe look at the another part of the yoga realm, which is, can we observe our body, not judge it, not say, boy, this is good or bad, because those kind of things trigger your chemical messengers in your brain to say, oh my God, you just said, you fool, why did you do that? And then your chemists in your brain are mixing the formula for, hey, let's just be stressed a little more because let's speak negatively, right? So if we learn to speak positively, we start to control the chemistry lab in our body, and we start to make nicer hormones or not make so much of this stuff that really tips our scale. So that's another element. And then if you look at the chronic pain component, or chronic conditions, we'll just say chronic conditions. Usually when we start to develop chronic conditions, we start to lose self-awareness. And self-awareness has this direct relationship with things like self-efficacy and the belief in yourself that you can do better and you can feel better. And but it all starts with self-awareness. And in yoga, when we start to look at the physical realm, we start to ask questions like, so lay on the floor and just notice, like, how does your shoulder sit next to the ground? Is the right shoulder blade resting heavier on the ground than the left? How is your pelvis? For someone with a scoliosis, they're going to automatically know, I feel a little cattywampus. I'm a little twisted and this side's heavy and this side's light. For someone who's a big ball of stress and tension and anxiety, it might be a little more challenging if that is layered with chronic conditions. So we just start to tap into, how am I even holding my body, and once we start to become aware of it, and then we add a little breath work, now we've got 2 layers of a yogic practice that we don't have to call yoga, but it's certainly not what you might get in with that type of an approach. It's certainly not what you might get in terms of a traditional clinic where
Yeah. Mm-hmm.
there's a lot of music playing and a lot of noise and a lot of sweet treats or foods to snack on and coffees and creamers and sugars and conversations where we're doing 3 sets of 10 and we're not really thinking about, am I compensating? Am I breathing?
Mm-hmm.
I get the social part to it, but you can't heal a chronic condition if you don't have self-awareness and you don't start to tap into these other issues.
So tell me, is it 100% of your patients that you find that to be helpful with? Or is it most of your patients? Is it 50%? Is it something that's just the way you treat? You always start with that awareness and breathing and really before you start working on the knee, you talk about the big picture. And do you see
Yeah,
that most people need that?
so that's a really good question. And I think the approach to that is more of the art side of it in
Okay.
my experience. Because yes, we all need it, but we also have to look at the individual sitting in front of me, right? If I start to say, hey, we're going to start to work on this through the breath, and I get that sense that they are just going to kind of tense up and press back and it's going to make them uncomfortable, or you start to see this anxiety component trigger in, then I'll probably say what I usually say in most of my yoga classes that I teach. The breath is the most important part, but it's probably the hardest, and it'll be the part that you integrate last because we come from a culture where it's like, what's the movement? Bend the elbow, straighten the elbow. Okay, got it. So now I've got the mechanics down, and now you want me to what? It becomes pat your belly or rub your belly, pat your head, and hop on one foot. It becomes that kind of like bombarding to the brain. So I might start to play around with, so the breath will be important, and we'll get to that versus another person when they come in, if they're all like, ah, my treatment one day, I've had plenty of clients where they've come in and, the treatment that day is, we're going to lay down. I'm going to put something to support you underneath your knees. I'm going to make sure the lights are off. Sometimes I'll have like a sound machine running, but I'll often put like a resonant breath bit of music on, or I'll play some music that I know to be therapeutic, or maybe a particular like alpha wave music, something that just like drops them out of the norm, that does as much as we can without feeling overwhelming to reducing that stress response, that sympathetic overdrive. And so then, from the insurance side of things, how do you document that? Well, that's on my end, that's easy. That's autonomic nervous system balancing. It's neuromuscular reeducation. It's nerve flossing to enhance the parasympathetic response, so that at that point, you just start to, where's your breath? How do you notice it? Do you feel tension? Can we try this? And people usually, when we come out of it and we come out of that slowly, it's a, wow, I feel like, whoa. Sometimes people feel really heavy because if we can get a release in the fascia, which is its own system and entity, people tend to feel really heavy, but in a good way. Sometimes we're tired because you don't realize just how much work it is to be tense and tight and engaged and your jaws clenching. That's a lot of work. So when you get a chance to like ease out of that, it's amazing how you find, you'll hear people, or I'll hear people tell me like, wow, I'm exhausted. I'm not sure what we did. My knee feels better, but you know.
So talk a little bit about the various elements of creating that rest and relaxation and that calm. I know there's various devices, feedback devices, different mats that you can lay on that run different currents, and then there's the smells, the aromas, there's the music, there's the light. Talk a little bit about, in your opinion, working with lots of patients, how effective are those different pieces all to come together, or is it really, or are they just kind of a fad?
It's a great question. So when we look at the science of these things individually, and maybe we'll go with scent, right? So people will often ask about essential oils. Are they all they're cracked up to be? Should I spend $100 on a bottle or $5 on a bottle? And the answer to that is going to be, it depends. It depends on, one, there has to be a preference. I'm really careful about, I have a diffuser that I run in one of my treatment rooms, but generally I will run eucalyptus and that's pretty much it. Eucalyptus is so good for the sinus passages, and I don't seem to have migraine or headache complaints with eucalyptus. Usually it's like, oh, I'm okay with this. Lavender is an oil that I think it's 15 hertz is where lavender sits in terms of its frequency, which is pretty neutral, and it's meant to be, not meant to be, it is. It's a pretty neutral oil, and it's grounding in the sense that it, for many individuals, feels calm and soothing, but not for all. So what's good for one isn't good for everyone. So this becomes the individualization of it. So at some level, you want a scent that isn't going to create a trigger, right? So we'll let that be whatever we would like it to be. There is research that does show that an oil like frankincense oil may be good for certain diagnoses, like in cancer treatments. And you'll see like the Mayo Clinic and Johns Hopkins, depending on the diagnoses of the department, they'll tell you what oils they recommend, if any, for certain things. So we know we have enough science to support certain dosages, certain frequency oils or certain oils for things. But in my case, I just want to chill people out. So we'll go with what I've got, or maybe we'll go with nothing. But I would say if scent isn't an easy offender, that helps, because if we use our senses, right? And I always have to point to my head to remember them all in oil. What do I hear? That might be music. There is some music is destructive, some music is constructive. Some music is healing, right? And this is where we get into sound therapy. And some music taps into particular brain waves. So alpha wave music, some people can't handle it because it sounds like needle on a vinyl record scratching, and it might not, it just might automatically not trigger them. But we'll find a sound, or maybe it's ocean waves, right? Maybe it's a white noise machine, something, because that's going to trigger the brain to go off in a direction. White noise can be very soothing for some individuals. Science supports that. So what are we hearing? What are we seeing? One of the things in a lot of clinics is bright lights and bright colors. And if you're a high stressed individual, that is not a good fit. So I've got a real dim light that bounces off of the corner. I try to have the overhead lights off just to automatically, like without even having to say it. You walk into a room and you're like, brought down a couple levels, right? So there aren't bright lights in your eyes. There might be a scent that's soothing. Maybe there's, I play a noise machine. Usually it's like ocean sound or rain. So that comes into play. So taste, sometimes we're like, I don't taste anything. Great. But is the philosophical question, is the absence of taste a taste? Is it not? How do we know, right? Do you feel thirsty? That sparks the conversation about hydration, which is incredibly important.
Sure.
So you can have that little education piece with that. Touch, what do I feel? What is the temperature? Is there a fan blowing on you? Is there a window that's open? Is it a good temperature? Also with touch, maybe we need a weighted blanket, right? So that might not be something that, oh, I have a 15-pound blanket actually right here. You might have a blanket. So I have yoga blankets that you fold up, and do I know the weight of them? No. I know they're not 15 pounds. I know they're a couple pounds by the time they're folded. Placing that maybe on the shins while someone's laying down, maybe even in the palms, or maybe just laying a blanket from the neck down. We know that that slight bit of proprioceptive feedback by that weight calms the nervous system, which is why weighted blankets have recommendations for people to use with anxiety. So, I think that's 10 to 15% of your body weight is what you're looking for maximum in terms of a weighted blanket. So then we've got that touch component that we're kicking in on. So hear, see, smell, taste, feel, we got them. And then your intuitive part, right? So that intuition, which the infamous sixth sense, that's a real thing. We get into yoga and we talk about the chakra and the third eye, but it really, and that to me feeds into your self-awareness. What is your body, what information is your body giving you right now? Is this a discomfort or a pain? Is this a sensation that you tend to feel is okay? Or is this a sensation that's starting to make you fearful? So what's your gut telling you? And your gut is a whole other nervous system, the enteric nervous system, which there's hypotheses and theories on that gut system working more, I guess, expediently than our brain. And that enteric nervous system in our heart. And if you look to the Heart Math Institute, which gives us a lot of information about what some people feel is a little hippy dippy in terms of the energetic realm, but there's some phenomenal science in the heart energies. And again, Heart Math Institute. So you've got this enteric system, this heart system, and what we know of as our brain, right? And there's theories on which one communicates the information faster and how does it do that. The typical example is when you walk into a room and your stomach sinks, and then something shows up and it's not good information for you. It's, oh, I knew it, I felt it in my gut, right? Well, there's theories to that, and it's scientific theories to that, and they can take you down a whole other, we could go off on 20 tangents on that. But it goes back to the integrative realm of, we have evidence. It may not be the highest evidence, but we have some support. How do we know if that is the best choice for us? Here comes the art, and here comes back to that. We have to individualize it based on that person's background and history and being.
So they do work, and they're very important. They all play a role in the overall recovery.
Yeah, you could have 500 things to pick from, and maybe for one person, 450 of those are going to be great. And for another person, 450 of those are going to be horrible. But we should be able to at least find one thing. So even when you look at taking yoga into healthcare, maybe of all of those tools we have, only one of them is a good fit that you know of, right? Take that one and work with it. Work with it. Yeah. Work with it.
And I would assume then, after you've done a session or two and you become more familiar with what works for each patient, then you simply incorporate that in future visits.
Absolutely.
Let's shift to a whole different realm, and that is, as a PT, I think what you do and what other PTs do is incredibly important and often the solution to a lot of problems. We have a healthcare system that often likes to jump quickly to more invasive remedies. You know, to a surgeon, everything is surgery and so forth. Talk a little bit about, from a PT's perspective, the balance between surgery and simply doing the work to try to resolve the issue.
Right. So I can probably go off on tangents. I don't need to go off on here. But when I do get clients, and I've had one recently who was like, I really want to avoid surgery. Let me do everything that I possibly can. Right. And I will tell people there's a time and place for surgery. We hope that there's enough indicators that come up quickly, like this is definitely a surgical consult. And, you know, if you have a disc fragment that is floating and impinging on your spinal cord, you need that surgically repaired. That's one of those, yeah. When we have a case where maybe we have a rotator cuff issue, that's a tear, maybe we have a disc bulge or herniation, there's some research studies that say, so meniscus is a good one in the knee, and meniscus is a good one. There's research studies that say 2 to 3 years out, if you compare, I took conservative measures, therapy only, and I did a surgical repair. There's 2 to 3 years out, you might be right at the same place. You know, meniscus studies tell us that. Rotator cuff, depends on your age and your variables. If you can get past the really horrible pain part, and you're okay with knowing where your outcomes may lie, you know, you might not need to go through that surgical procedure. After a certain age, addressing a rotator cuff, you tend to let's look at the non-surgical approach and see if we can rehab the muscles that might be able to compensate for what's going on. Because again, 2 to 3 years later, we're at about the same place. Your quality of life during that crunch period is the big impact. You know, are we able to manage this period of time where things are going to be pretty sticky and maybe uncomfortable? But I will tell people at the end of the day, a surgery is probably not going to fix a good chunk of issues that have now had this domino effect. We get pain, we don't move as much, things get tight. When fascia gets tight, it can exert a force of 2,000 pounds of pressure per square inch. That is a lot of force. And in my opinion, that is where a lot of back issues spiral into what seems to be this massive issue. And a surgery won't fix tight fascia. A surgery won't fix compressed muscles impinging on nerves. Hydration, mobility, lengthening, not stretching, but you can call it stretching, you know, strengthening mixed with lengthening. Those things start to address bigger pictures. You add the nutrition piece into it, and now we've got even a bigger realm. And nutrition falls into yoga lifestyle, you know. So do you need that surgery? That's a great question. Even if you figure, at some point my surgeon said maybe, get your lifestyle in order. Start doing things that are going to benefit you. And a lot of people find, you know, I can manage this. I've learned I can manage this a whole lot better. Maybe I can postpone surgery. Maybe I don't need surgery. A client that I just had recently was hoping to be able to avoid surgery. She has a particular condition in her spine, though, that it really does need to be addressed. So she has a surgical date coming up, and she said, wow, I'd like to continue therapy, though. And I'm like, well, that would be what I would recommend, not because I want to, you know, keep my schedule padded, but because there are so many issues to address that involve how do we watch our posture? How do we strengthen our core muscles? You know, how do I continue to work on safely lengthening, you know, these hamstrings and these back muscles and these psoas muscles and these things that are probably only going to get tighter immediately after surgery, especially if you're, you know, not as mobile in a hospital bed for even a day or two. We want to keep moving forward. So, you know, a couple weeks of pre-operative interventions and then see how she does post-op. And hopefully she's got everything she's going to need to, you know, lifelong manage this.
Cool. So we just had a question come in from one of our attendees. Is there research that supports getting regular therapeutic massages? And if so, at what frequency?
That's a really good question. So for me to tell you, I've looked recently at that research to give you a specified answer. I don't know. But here's going to be my response to that on my end. If we look at research for what's the benefit of therapeutic massage, there are going to be so many variables. I think it's going to make it's going to always have a debatable situation, particularly in relation to insurance, right? So why doesn't insurance pay for massage more? Or, some insurances are paying for that. We know
Mhm.
it keeps tissue more pliable, it keeps fascia more pliable. People are happier. Most people like massage, not all, but we tend to feel better. We get this input and this movement of lymph and circulation. So, what's the recommended frequency? I have people who get massage monthly. I have some people who get every 2 weeks. Financially, there's going to be a barrier or restriction there.
Sure.
But I would probably go if you're relatively in an okay place in your body, right? So not severe issues or significant issues. I would say once every 4 to 6 weeks on a regular basis is going to do wonders for you for keeping a lot of things in check. Now, that said, that's going to be if something starts to tweak or flare up, maybe you need to do a couple sessions at a little closer frequency. If you feel like, wow, every 6 weeks has been going good, maybe you find a time where you can tweak to every 8 weeks. I do think that people function better when they're able to keep that in a regular part of their routine. Um, I know
Nice.
I use a lot of manual work when I work with people. It keeps things moving. The downside to what I do is I just don't have the time, and I would never compare myself to a massotherapist, the expertise in a whole body massage in a way that's therapeutically appropriate. So the whole body is always going to be way better than just a chopped off segment or
There you
section, but we do the best we can with what we've got. We do our best, and our best is, in our case, hopefully good enough, backed with the mix of the art and the science of what we do.
So, Dr. Kerr, I know that you're going to need to leave here pretty soon. So, in an effort to sort of wrap up, are there any comments or thoughts that you'd like to share that we haven't talked about that would be helpful to the audience just from your experience?
Oh boy, I think we underestimate the power of what's in our brains if we're working in healthcare. From the physical therapy aspect, we need to be more proactive and feel confident in educating people on the importance of hydrating. If we drink, um, the recommended dosage of water a day is half your body weight in ounces. To tell someone to do that who doesn't usually do that is not good. If you just say, yeah, just go drink half your body weight in ounces, right? It has to be a graduated thing. When we're not well hydrated, nothing functions well. Your brain is 60% water. The minute you feel thirsty, you're already clinically dehydrated. So if we want to be working with our clients so that they think better, function better, feel better, have less pain, we really have to hit that nutrition piece with hydration and then tackle in the nutrition piece, which is a whole entity in and of itself. But those two things right there might give the bigger breakthrough to not just function, but mood as well,
Mhm.
because our mood is a direct result of the food that we're putting in our system. And I'm not saying you're going to heal every mental health issue with your diet, but I am saying you are going to have a much better supportive environment for a better state of mental health if you're looking at the food you're putting into your body in terms of, is this a inflammatory food? Is it a sugar? Is it a highly overly processed? We know those things lead to a lower state of mental health. So yeah, that's a piece that really needs to be brought into the picture a little bit more, I think, from every aspect. And if we aren't doing that ourselves and we're expecting our clients to do it, we got a little work to do on ourselves, which makes it real to people we work with and accessible, like we all struggle with things. So
Yeah.
we just need to be honest about it.
Awesome. Well, Dr. Kerr, thank you so much. I'm going to let you go because I know you need to run, but I'm going to go ahead and close things up. But thank you again. This has been
This has
delightful.
been great.
Thank you so much.
Absolutely. I appreciate your time. Appreciate your time. Be well.
You take care. So in conclusion, we have a real treat today here at the conclusion of the huddle. Stay tuned and I'll play a video of an incredible story of true inspiration. We will not be holding a huddle this next Monday. So our next huddle will be next Wednesday, June 10th. And our guest panelists will be a group of college students who will be discussing their outlook on the future in light of the economic challenges and how they're staying positive. Following this huddle, you'll receive an email. It's a survey. We recommend you take a few minutes and give us feedback. If you have any suggestions on topics for future huddles, please share those with us. And if you have any suggestions on panelists that you think would be helpful and appropriate, please share those with us. You can contact us through the Going on Offense website on the Contact Us page. We want to again thank Dr. Kerr for her participation today. We also want to thank the organizations that have gotten behind this movement. Please take advantage of the wonderful offers, recommendations, suggestions, ideas on our helps page. There's a number of organizations that are offering free services right now to help people. Please take advantage of those. And we will be recording today's huddle and we'll be posting that later today. So now, in conclusion, I'd like to show a video, Never Ever Give Up, Arthur's Inspirational Transformation. We'll sign off now and say goodbye. So again, join us for a future huddle and enjoy this video.